guys. It's morning here. Dr. Andrew, Dr. Jordan, Mouw Family Chiropractic, and we're going to be covering a really important topic on this webinar that we are passionate about. We work with every day, and that can be such a big issue for many Americans as they go through their life in maybe different stages. And so we feel that we can bring some helpful information to you on this really important subject. And I'm excited to dive into it with you guys. So just to kind of give you a lay of the land, so to speak, three things we're going to be going through is understanding back pain, first of all. There's a lot of misinformation out there on this. There's a lot of different ideas about it. And so we really want to set the record straight with what we know is true, what we've seen to be true time and time again about this topic, really get you some really concrete information you can dig into and count on. Number two, being the understanding the cause of back pain. And so sometimes this can be like a bit of an enigma for people. It's like, where is it coming from? Why is it here? Why am I experiencing this? How do I get rid of it? Those things. And we know that it's not, it's more of a functional deficit than it is like a disease or a sickness. We know that if the body is functioning at its proper level, if things are working right inside the body, we're not going to be dealing with back pain. And I also want to dig into the value of pain, that it's a signal. It's just a signal that something is off in our body. It's not necessarily a bad thing. It's telling us that we need to make some changes. And so we'll talk about like what does that mean? How do we deal with that? And so forth, going into that. So, and then of course, what can we do to stop it? This kind of moves me because, back pain isn't just back pain. It affects when someone has it, and if you've had it, and you've had significant back pain, it's not just your back that affects, it's pretty much everything about your life. Like, it's hard to do anything when your back is in a bad spot. You don't realize how much you use your back until you have a problem with it, and then it's like, wow, like I can't do anything without this being affected. So it's not just a symptom to us. It's how is this really affecting someone's life, and how is it keeping them back from life? And we get excited when we get to see them go back to living that life that they want to live, being able to do the things that you want to be able to do. So, and there's three really things that we cover on this of what we do to deal with this. And this is kind of the recipe. If we wanna, put something in the oven and we want a predictable outcome on the other side of the oven, if we're baking something or we're making something, we follow a specific recipe. There's certain things that we have to have in place for us to be confident about what's going to come out on the other side. And so this is an analogy that we use to just kind of describe what that recipe is. And so it's a three-legged stool. And if you have a three-legged stool and you pull out one of those legs, what's going to happen to that stool? Well, it's going to fall over. And so what that means is each one of these three aspects of this is super important, vitally important. And if we're missing one of them, we're really not going to have a good outcome on the other side. We're not going to be confident about our ability to take on this challenge of a low back problem and solve it. And so the three legs, if you will, number one is adjustments in rhythm. And so what that means is we'll basically be adjusting the spine, getting the spine in a better position, and there's got to be some consistency around that. We'll go into this a little bit more in depth.
If you have no idea what an adjustment is, you will by the end of it,
yeah,
for sure.
Number two is breaking bad habits. So there's certain habits that can affect this problem. And number three is we want to strengthen the body to help restore function as well. So that's kind of a brief overview there.
So how bad is it? If you've ever experienced low back pain, you know how bad it can get. In fact, when I was going through chiropractic school, I sustained 3 really bad low back injuries from deadlifting and squatting over about a 9-month period of time. I can tell you that the first time it happened, I didn't notice it right away. I went and worked out in the morning, around 9 o'clock that morning, and then my wife and I, we had to leave to go back home, and it was about a 6-hour drive. And it wasn't until after that 6-hour drive, we got home at around 4 or 5, that all of a sudden I started to notice like something was off. And one of the things that we're going to talk about today is posture and how posture affects it. But I looked in the mirror and I had noticed that I was kind of shifted off to one side. This is something that we call an antalgic posture. But basically what the body's doing is it's compensating to prevent nerve irritation. So we're going to talk about the nervous system. But this was really debilitating. And so I followed the recipe and I got back to where I needed to be. But if you've never experienced low back pain before, which if you're watching this, you probably have experienced with it. But if you've never experienced low back pain, you can't appreciate how bad it can get for people. And the biggest concern, like Dr. Andrew alluded to a little bit earlier, is that it affects your life, right? It affects everything that you do. It affects every activity that you do, your ability to play with your grandkids, the ability to walk through a grocery store and get your groceries. It affects your ability to work out and to be active, right? So it influences every area, and that's our biggest concern, is that it starts to invade other areas. But I don't so much want to focus on what we have to say about low back pain, but we also want to focus on the research. And so I have a little bit of information here that I want to read to you because I think it illustrates the crisis that we're experiencing when it comes to low back pain or back pain in general. It says here, this is out of JAMA, which is a great research journal. It says over 10% of visits to primary care physicians are related to back and neck pain. And this represents the 5th most common reason for all doctors' visits. It accounts for approximately $86 billion in health spending annually. So annually we're spending $86 billion, but that's not including the loss of productivity, right? The lost days at work. That's another $20 billion. So we're talking over $100 billion of our healthcare expenditures every year are spent on low back and neck pain. And it talks about the steep rise in drug costs. So we are now spending as much on spine pain problems as we do on cancer and arthritis. Some of the largest increases have been on expenditures related to drug treatments. Overall, pharmaceutical expenditures related to back and neck pain increased by 188% between 1997 and 2005. But costs associated with prescription narcotics rose by a whopping 423%. If we are spending more on diagnosis and treatment, we should expect to see health status changes or results that are commensurate with the investment, but that is not what we are seeing. Researchers from the University of Washington found that the nation's dramatic rise in expenditures for the diagnosis and treatment of back and neck pain has not led to the expected improvement in patient health. What that's saying is that we're suffering, right? Our country is suffering, our communities are suffering as a result of this back pain issue that's completely correctable. We're going to talk about that. They go on to say that in this article, it says a recent study documenting increases in Medicare expenditures showed a 629% increase in epidural steroid injections, a 423% increase in expenditures for opioids for back pain, 307% increase in lumbar MRIs, a 231% increase in facet joint injections, and a 220% increase in spinal fusion surgeries. The limited studies available suggest that these increases have not been accompanied by population-level improvements in patient outcomes or disability rates. In essence, what this is saying is that we're spending a ton of money, we're spending a lot of resources, but our outcomes are very poor. And so we don't just have a healthcare issue, we don't just have a economic issue on our hand, we have a health issue on our hand. And so we need to do something different that'll start to address these issues. And so we're going to dive into that tonight. In fact, if you look at low back pain globally, what it shows is it's actually the #1 disability in the entire world, which is pretty significant.
Yeah, so basically what does this look like? And these are the things that are going along with this, bubble of low back pain, and if you've had this before, you've experienced these things. So we have low back pain, we have tight muscles. Anyone ever had a muscle spasm? Like, man, that can be crazy, right? You can drop you to the floor like really fast. Lost range of motion. Hey, I'm like suddenly moving like my grandpa, right? Like I can't even like stand up straight. I feel like a 90-year-old man like getting out of bed in the morning. Like I can't get down on the floor with my kids. I can't even bend my leg up to tie my shoe, right? These are a lot of the things that go on. Stiffness, leg pain. You can have shooting pain, numbness, tingling in your legs from this issue. We can have swelling and burning and numbness going on. So there's a lot of things that are coming from this one problem. So one of the things that, speaking of leg pain, is there's this thing called sciatica. And so I think some people know what this means and some people think it's something else. But to set the record straight, sciatica is irritation of the low back nerves that go into your legs, which creates pain, numbness, tingling in your leg. It's not a leg problem, it's actually a low back nerve problem. And so that's why, well, where do the nerves that go to your legs, where do they come from? They come from your low back. So that's the connection there. And so it can get trapped, in the lumbar spine up here. It can get trapped when it goes through your gluteal area. You have a lot of muscles and ligaments going through that area, and that can affect that whole leg there. You've got some muscle involvement, the piriformis. We talk about that a lot, and so that's what sciatica is.
So disc herniations. In fact, the number one cause of sciatica is disc herniations. So there's a few different things that can cause sciatica. As Dr. Andrew alluded to, it can be a muscle issue where your piriformis muscle, that's a muscle that runs across your butt, that muscle can become tight and it can cause something called piriformis syndrome. What we're talking about here today is we're going to talk about disc herniations. I think there's a lot of people who don't understand what a disc herniation actually means. In fact, this can be a bulging disc, this can be a slip disc. There's a lot of terminology that's used around it: disc protrusion, disc sequestration, where it actually breaks off or ruptures, okay, so disc rupture. We're going to talk about disc herniation, slip disc, mild, severe. It's all the same, okay? So disc herniation, what does that exactly mean? Well, if you've ever had a hernia before, what it means is that there's tissue that's in a place that it's not supposed to be. So in this case, we're talking about a swollen disc, and that disc material is in an area where it's not supposed to be. So let's talk about anatomy just a little bit. So this is a joint right here in the body. We call this a motion unit or a unit, a joint unit. Okay, so this is one joint unit, and this is just showing it in your low back because that's what we're discussing today. So this is the front part of your spine. This is the back part of your spine. If you see it right here, this protrusion right here is called the spinous process. So if you're watching this with somebody and you reach next to them and you feel those bumps along their spine, that's the spinous process. That's right through here. Okay, so that's what that's showing right here. This right here is what's called your facet joints. This is where your joints articulate with one another. You can see your spinal cord traveling right down through here, and then the nerve root actually branches out right here. And this guy right here is the disc, okay? The red area is showing a disc herniation in this example, okay? Now, if you took a bird's eye view of it, this is what it looks like from kind of a 30,000 foot view from above. So if you look down your spine, this is what you would see, okay? So once again, this is your disc right here, okay? In the middle is something called a nucleus. Okay, so this is the middle part, this is a nucleus, this is your annular fibers around the outside of it. And then if you look down your spinal cord, so this is the spinal cord right here, and then these are the nerve roots that branch out, okay? And these, eventually what they do is they branch off the spinal cord, and then as they feed the tissues of your body, they'll branch out again, a lot like roots of a tree. Well, what can happen is this nuclear material, so I want to give you an analogy on how to think about a disc. A disc operates a lot like a jelly-filled donut, okay? So think about a jelly-filled donut. In the middle, believe it or not, they actually make this thing called a donut, and they stick jelly in them. I know you guys don't know what that is, because if you watch the 15 Pounds Healthier in 15 Weeks, we don't discuss jelly-filled donuts as a way to achieve success with your health, okay? But what you'll see is in the middle of a jelly-filled donut, there's the jelly, and then there's the breading around the outside, okay? Well, when your spine moves, it acts like where that movement generates fluid for the disc, okay? So you have the nucleus right here. Well, over time, when you stress a joint, okay? When you turn and twist, when you bend, you move, you're in a car accident, you have a slip and fall, it'll tear these annular fibers, okay? And there's about 30 concentric rings of annular fibers that surround that nucleus. And over time, you'll start tearing those annular fibers one by one. And the most common area for you to experience this is that the disc or the nuclear material will actually go to the back of the spine. Okay, and the reason for that is because of the ligament structure. I'm not going to dive into that. There's probably too much detail, but just know that the ligament back here is really thin, so you have a tendency to have a herniation in the posterior or backwards direction. And over time, when that nuclear material, it herniates, it'll actually start to compress that nerve. And that's where the disc herniation will actually take place. And over time, you'll start to notice that pain. It'll start off as low back pain, but it'll eventually progress to the point where you're getting pain down the leg. Okay? So that's a disc herniation. It's tissue in an area where it's not supposed to be, and they range from mild to moderate to severe disc herniations. Okay? So this is a picture of the lumbar spine. So we never go too far without one of these guys, okay? So this is your spine. Now to just kind of position yourself or get an idea of where we're at, right up top here is your brain, okay? Your brain is your most important organ, and the reason we know that is because it's totally encased in bone. Now if you look at the bottom of your skull, you'll notice that there's a hole at the bottom. That's where your brain stem sits. This is called your foramen magnum. In Latin, that means big hole. Okay? And your brainstem continues down as your spinal cord, and your spinal cord branches out 62 times. So 31 on the right side and 31 times on the left side. Well, these nerve roots right here are those branches off of your spinal cord. Okay? The spinal cord is just a continuation of your brain. That's what it is. Your brain and your spinal cord are your central nervous system. Once you get to your nerve roots, those 62 branches, that's called your peripheral nervous system. And so these nerves will literally branch out, and it feeds every tissue, organ system in your body. Okay? Every cell in your body. Well, then if you look at the anatomy of the spine, you'll notice that it's jointed. So there's 24 joints in your spine, and what that does is it allows for movement of the spine. The purpose of your skull and your spine is it protects your nervous system. It houses the nervous system to prevent damage, okay, or like a severing of your spinal cord, right? Well, in between each of these joints is a disc. Okay, the purpose of that disc isn't as a shock absorber. The number one job of a disc is to act as a spacer. What it does is it creates a hole called a foramen for those nerve roots to branch out without becoming impinged. Okay, so that's the number one job of a disc. The curvature to the spine is actually the shock absorber. So if you look at the spine in terms of its overall structure, you'll notice that from the front it should be straight. And I teach kids that it's straight like a straw. If you had a straight straw and you push top to bottom, you'd notice that it's really strong. If you put a bend in it, what happens? It fails, right? Then if you look at the spine from the side, you should notice a beautiful system of curves. Okay? The purpose of these curves is to act as the spring mechanism for the body. The curves are really what gives your body longevity. Okay? That's really what the curves are there for. When you're born, your spine is in the shape of a C. Okay? It's called a primary curve. Well, when you set a little one down on the ground to do tummy time, they'll look around at the world around them, right? They want to see what's going on. So that tummy time is really important because it develops what's called their cervical curve or their secondary curve in their neck. So this is the cervical spine up top here. Well, then eventually over time they'll start to push themselves up, and as they start to crawl, gravity will pull on their belly, and that'll form what's called their lumbar curve in their low back. And then you take that little one and you stand them up, and you see that beautiful system of curves. That's the spring mechanism for the body. If you want a healthy nervous system, you have to have a healthy spine. If you want a healthy spine, you have to have healthy discs. Okay, so that's the importance of a disc in the spine and the reason we take care of so many issues when these go sideways. Okay, so this is the lumbar spine. What it's showing you here is it's showing you the entire spine, but we're really focusing down in here on the bottom 5 segments. Yep. So subluxation is when one of these spinal joints gets shifted out of position. Okay, so green, we just relate that to if you come up to a stoplight and you see a green light, you go, right? Well, over time, if you stress your body enough, that joint is going to shift out of alignment. And there's a series of events that take place, but the word for this is subluxation. Okay, so if you're a patient, you should definitely have heard of this. If you've never been to a chiropractor or you're just trying to find out what's going on with my back and you're watching this, the word that we use in our office is something called a subluxation. Okay? A subluxation has a sequelae of events. There's a series of events that happens in the body that shifts the body into a different position when the body is subluxated. So the first thing that'll happen is you'll have joint misalignment. Okay? The body's not going to allow it to move how it's supposed to. That joint has literally been shifted to a place that it can't move. Over time, think about it like a sprained ankle. It'll create soft tissue damage, and if you've ever sprained an ankle before, you know that it swells up. Well, that swelling is inflammation in the area, and that inflammation creates nerve irritation. Anybody have irritated nerves? Okay? If you experience pain, you probably have an irritated nerve. Okay? Well, what happens is that creates something called muscle spasm and pain. I want to pause here for a second and kind of separate these two because this is a really important point. A muscle spasm and pain, if you think about your body, right? Let me ask you this. Is your body smart or stupid? Smart, right? It's actually really smart. And so what your body does is it responds to the environment that you put it in. Well, a muscle spasm, for 99% of a muscle's life, it's going to be a joint mover, right? It lengthens and it shortens. It lengthens and it shortens to allow you to move throughout your environment. What happens is when a joint becomes damaged, it becomes a strap. Okay? What it is that muscle spasm is a guarding mechanism for your body. So let me ask you a question. Muscle relaxers, are they good or bad to take? Okay? I'm going to let you answer that one, okay? But just understand, when you take a muscle relaxer, what it does is it relaxes the muscle. So you're like, hey, I feel better, right? Now all of a sudden you can move and you can do everything you need to. The problem is that the joint was never corrected. So all of a sudden you start to do more damage through that process. Now let's talk about pain. Do you think pain's a good thing or a bad thing? Most people, 95% of people would probably answer that by saying, well, pain's a bad thing. Why? Because, hey, it's telling them that there's an issue, right? It's limiting them in what they're able to do. They don't want to feel pain. The problem is that we actually need to take a different perspective with pain, and we need to realize that pain is actually a really healthy thing for the body. It's the way in which your body communicates. Dr. Andrew mentioned a little bit earlier this little term called body signals. So rather than talking about symptoms, we refer to them in the office as a body signal. It's not a cute little term that we just came up with. Well, it kind of is, okay? But what the purpose of a body signal is pain is the way in which your body is signaling to you that there's an issue going on. Okay? What your body's trying to tell you is trying to tell you to take care of yourself. Right? And a lot of times what we do, and we make the mistake, and I've been there before, is you try to ignore your way out of the problem. Right? You're never going to ignore your way out of the problem. Now, if you have an acute injury, okay, so I have patients that come in all the time, I'll do a consultation with them, and they'll say something along the lines of, well, Dr. Jordan, I noticed I started having low back pain about 10 years ago, but I was able to rest for 2 or 3 days, and then I was back on my feet, okay? Well, what happened is the inflammation went away, it stopped irritating the nerve. The problem is that the joint was never corrected. So a lot of times they've had this happen 5 or 6 times, and then 10 years down the road, they come into our office and say, hey, this time I can't overcome it. Right? You've heard this, haven't you, Doc? So, this time I've had it for 4 weeks, and my body doesn't seem to overcome the issue this time. Well, the reason for that is your joint is literally starting to scream at you because you didn't take care of the issue 10 years ago when it started because you thought that if you just rested, it was going to correct everything, right? Well, the cause was never corrected. Not only that, but think about pain, right? Does pain set in at the beginning of a problem or at the end of a problem? Think about a heart attack. Does a heart attack set in at the beginning of heart disease or at the end of heart disease? usually the end of heart disease, right? In 100% of the cases, heart attack is usually at the end, right? Pain is the same way. If you wait until you have pain to address your health, you're going to have a lot of issues come up, and you're going to start to notice a lower quality of life as a result. Okay, so I hope this gives you a different perspective on what is a muscle spasm doing and what is pain telling me. The other issue that happens is something called lost imbibition. So if a subluxation has been there long enough, we're talking about 5 years plus, what we'll start to notice was we'll actually start to notice dehydration of the disc. Earlier we talked about a disc is like a jelly-filled donut. Now I'm going to relate it to chicken, okay? If you think about nice, healthy chicken, that's nice and juicy, okay? A disc should be the same way. When a disc is healthy, it's full of fluid, and that fluid is being pumped throughout the body, okay? Your spine doesn't move like this. Your disc is pumped by movement that looks like this, okay? That's called imbibition. Okay. Over time, what happens is when your joint doesn't move how it's supposed to, where it's subluxated, that disc will start to thin, and think about it like rotten, nasty, dried out chicken. Okay. That's the difference between a healthy disc and an unhealthy disc. And with that disc starting to thin out, that creates joint fixation. Okay. And it creates this thing called a movement deficiency syndrome. Okay. What that means is that you can't move how you need to move. Not only on a micro level, okay, not just segmentally you can't move, but globally through gross, broad ranges of motion, you can no longer move, okay? And it starts to limit your range of motion, which is what Dr. Andrew talked about earlier. So we have macro movement deficiency syndrome, and we have micro deficiency movement syndrome. And long term, this creates a thing called global or toxic global physiology. It literally starts to affect the entire body. We're not going to dive into sympathetic and parasympathetic and autonomic nervous system, but other areas of the body start to get affected because of this lack of gross motor movement. Okay, so I know that's a lot of information. If you need to go back and watch it, that's why we're doing webinars.
And so this is a concept that Dr. Jordan kind of touched on a little bit, but it's really, we don't want to wait until we have pain to take care of ourselves. That's kind of the concept here. And the reason there's a physiological principle or a scientific principle of why this is true. And a lot of us make the mistake of thinking that, hey, if we have a problem in our body, we're gonna feel it. And that's just not true as we look at the body. You know, he used the example of a heart attack, right? The patient doesn't feel the arteries clogging up when that problem is going on. But just because they don't feel it doesn't mean that it's not happening. Another example could be like a cavity in your mouth. Is it possible to walk around with a cavity in your mouth, have no pain, have no idea that it's going on, then you go to the dentist for a regular checkup, they take an x-ray, and they see down inside, oh man, you got a cavity going on there. We got to do something about that, or that's going to create a big problem, right? And so we can't rely on the presence of pain to tell us to take care of ourselves, to tell us that there's a problem. And so why that is, guys, is you look at the nervous system, only about 10% of your nervous system is designed to receive pain. There's a lot of other things going on inside of our body, respiration, heartbeat, you know, like things like that we are automatic, we don't have to think about, secretion of glands, temperature and pressure. Our body's constantly monitoring those things. Motion of our body, position of our body, all that has nothing to do with pain. You think about, when's the last time you thought about your pancreas functioning, right? And is it at 60% function or 85% function? You have no idea, right? Your body takes care of that and all the other functions outside of just feeling pain. So a small percentage is actually devoted for pain, and that's why we can have a big problem without ever really feeling it or knowing that it's there. There's a study, Colorado, 1999. They actually did a study on nerve conduction of a frog, and they found that that frog's nerve could lose up to 60% function without there having been a pain signal. And so that's why we need to have objective ways on how to measure whether our body's functioning properly and it's healthy, not just subjective ways. Because if we just rely on the presence of pain, we just rely on that little 10%. I mean, think about a pie chart. How much of that pie chart is 10%? It's very small, right? If we just rely on that little bit, we're still exposing ourselves to massive risk that there's something going on, there's a problem developing. So, as we look at this, this is kind of what the lumbar spine looks like on an x-ray. And so basically, I'll just kind of walk you through the parts of normal. This is from the side, so from about here to here. So this is a person's, their back. Dr. Jordan's talked about the spinous process. That's where the spinous processes are. This is a person's front or their stomach, and we want to see a nice curvature, a nice arc in that low back. We don't want it to be straight up and down like he was talking about the curves. Curves will give us spring. That's one of the first things we look for, is that curvature, or are we straight, right? We look for the discs, we want nice tall discs like he was talking about. We look for the edges of the bones. We don't want to see sharp, jagged edges, any evidence of arthritis, bone spurs, those sorts of things. And nice space for those nerves to come out of those foramen, those holes there. And so this is an example of what subluxation could look like. Looks like a lot of different ways, but this is just one example. So you can see the breakdown in the curve. It's not nice and smooth. We're looking at a jaggedy curve here. It's not, and then you can see just how the backs of the bones aren't lining up well. Down here, it's like, yeah, we got a problem. Well, what about the discs? That's a great looking disc right there, but what's happening to this disc, right? A lot less space there. It's collapsing, compressing. How about this disc? How about that disc, right? Look at the edges of the bones, right? These are more smooth up here, but look at this. And it may be hard for you guys to see this up close, but we've got sharp, jaggedy edges here, bone spurs and arthritis going on because of these things happening. So, and you got to remember that as you're looking at this, you got to remember the spinal cord is running down in the back of those bones, right? And you've got the nerves that are coming out of those holes. And so when we have this happen, well, that's not just affecting the bones, right? Yeah, it's affecting the disc, it's affecting the spinal cord running down, and it's affecting those nerves coming out. So that's like why this is such a bad thing. And this is an MRI. And so this is exactly what I was talking about. The spinal cord's running down. You can see that. You won't see that on the x-ray. You can see the disc here, and you can see how that disc is pushing into the spinal cord. It's like bad, right? And so that's why we get so excited as chiropractors, is because we know that we're not just taking care of the spine, we're really taking care of the nervous system. We're not back doctors, we're nervous system doctors, we're doctors of function. And that is a life problem right there. That's not just a pain, that's not just a back problem, that is a life problem when it's impacting your spinal cord and your nerves right there. So. And I would say that, like I think Dr. Jordan mentioned this, a disc does not slip. It is very much connected to your bones. It doesn't slide around in there. It just, parts of it will push out, herniate, things like that. So a slip disc is not a disc slipping out of place. That doesn't happen. And so as we look at the MRI here, this is the example of a real case of a doctor that we know, and sometimes we don't really see these as we get through treatment and someone's doing really well. A lot of times we won't see a second MRI to compare to, but in this case we do, and it's pretty cool to look at, and we just wanted to show this to you. And so this is when he was in a problem, and he was in the beginning of where he was at as far as before adjustments and before care. You can see that here's his spine, here's his spinal cord running down that white part there, and you can see that disc is compressing that spinal cord. So it's a big problem here. And then this is about after 12 months of care, what his MRI looked like at that point. And he was following the recipe, the three-legged stool. And this is what this can create, is look at that disc. It's no longer pushing into the spinal cord and the nerves. It's really in its proper boundaries, and it's where it needs to be again. And the guy's healthy and functioning well. So yeah, pretty cool.
So when we look at different treatments, So one of the things that we'll talk about is we'll compare different chiropractic approaches. We're going to touch on that in a little bit, but if you just look at traditional treatment for these, usually start at the top with heat and bed rest. One of the things I will say about heat is that you got to remember, one of the things I discussed earlier was inflammation, right? Remember, this is like a sprained ankle, right? Would you put heat on a sprained ankle? Do you put heat on inflammation? No, right? What do? We put ice on it, okay? So heat's gonna create a bigger problem. Now, you may feel good in the moment. The problem is long term, you're gonna drive in more inflammation into the area. We're gonna have a bigger issue, okay? Medications. Let's talk a little bit about medications because this is becoming a bigger issue. You talk about the opioid epidemic becoming a bigger problem as well. But let's just take a look at what the research shows. So this comes out of the New England Journal of Medicine. It says people that take analgesic drugs frequently may be at increased risk of end-stage renal disease. So end-stage renal disease, just talking about kidney disease. Those who took 105 to 365 acetaminophen or Tylenol, okay, this is one a day, okay, pills per year, had a 40% increased risk of end-stage renal disease, okay? For those who took more than 365 acetaminophen pills in a year, the increased risk of end-stage kidney disease was 110%. For some, the increased risk of end-stage renal disease was as high as 270%. Ibuprofen ingestion accounts for nearly 60,000 deaths from acute bleeding ulcers. Acetaminophen ingestion or Tylenol ingestion accounts for 12% of all patients hospitalized with drug overdose. Tylenol ingestion accounts for 40% of patients with acute liver failure. Tylenol, acetaminophen, whose best known brand name is Tylenol, is one of the most widely used non-prescription painkillers in the U.S. Overdosing with it is the leading cause of serious poisoning in the United States. Every year, too much Tylenol accounts for 50,000 emergency room visits, 42% of liver failures, and an average of 458 deaths. Vicodin, okay, now we're talking about Vicodin. It is currently the most popular prescription drug in the United States. Some patients become addicted to the opiate compound of Vicodin and consume increased amounts of Tylenol, ultimately leading to acute liver failure. With overwhelming liver injury from Tylenol, what follows is a particular grisly death punctuated by bleeding, confusion, coma, brain swelling, damage, and death. This situation is particularly tragic in young children accidentally overdosed with acetaminophen, typically in the setting of a flu-like illness by well-intentioned but misinformed parents. What I want you guys to understand is that over-the-counter medication is the fast food of the pharmaceutical industry. Okay, sometimes drugs are absolutely necessary, but under the right circumstances, but under the right time as well. Currently, most people use medications as a lifestyle, okay? It's a part of our culture. Medications are not intended to be a lifestyle, right? We have to start questioning things when we need to start sorting out our pills every single day, okay? I mean, that's an issue, right? We should be questioning, is this the right thing? Are we doing the right things by our body taking these things, right? So we're not opposed to medication. We're never going to tell you to take medication or not to take medication, but you have to understand what it does to your body. There are side effects, and I don't call them side effects, they are effects. Right? They are actually challenges that people experience as a result of taking the medication. So the other thing is physical therapy. I think physical therapy is awesome. I think as a standalone rehab process, there's more things than just physical therapy that you can do. But yeah, actively moving and stretches and stuff like that are an important part of that, which is why we teach our patients active therapy, right? Steroid injections, as we said, becoming very popular, especially cortisone injections. A lot of times this can get somebody, the goal of cortisone, just to explain that to you, is to reduce inflammation, right? So theoretically, there's the right idea there, right, to reduce the inflammation. I mean, that's what we're trying to do with ice, is to reduce inflammation. The problem is that as you're driving out the inflammation, the cortisone will often break down the lining of the synovium, which generates the fluid for the disc. So long term, your health is going to be worse off because you're breaking down the joint. Now, you just have to weigh the risks of that with, where are you at with your health? Right? And so is that a valuable thing? Some patients will get to the point where they just manage their pain, right? Pain management becomes a part of their process, which is a sad thing, right? Because if I told you, hey, we're gonna manage your pain, that doesn't sound that fun, right? And so that's another thing. And then, of course, surgery, right? And then alternatives. So if you just look at, in terms of just going back to medications a little bit and just talking about oxycodone or hydrocodone, oxycodone, those sorts of things, fentanyl, morphine. I mean, you look at, this is 1992, I know this is cut off, and this is 2016. I mean, you look at the amount of production of these medications. I mean, we went from nearly 10,000 kilograms to almost 160,000 kilograms of oxycodone being produced in the United States. And that's over, I mean, how old were you in 1992, right? Don't say it, but I mean, that's not that long ago, right? And just over a 25, 30 year span, we've increased our production, 16-fold. You look at opioid prescriptions per 100 people, okay? Iowa, Nebraska, right here, okay? This is yellow. That means for every 100 people, we're filling 65 to 82 opioid prescriptions, right? On an annual basis, right? So, I mean, we have states in the United States where we're filling, especially in the southern United States, where we're filling over 100, almost 150 prescriptions of opioids per 100 people. Right? So that's a 1.5 to 1 ratio of opioids to people, right? That's a scary thing. This is showing that we have enough prescription painkillers were prescribed. In 2010, we had enough prescription painkillers to medicate every American adult around the clock for a month. That's staggering. We had 40 people die a day from narcotic prescription overdose. This is an issue. And it's becoming a national issue. It's becoming an economic issue. These opioids are a gateway to even more significant. You talk about heroin use and everything else. The addictive component is really important. This is overdose deaths involved with opioids, cocaine, and heroin. Okay, so this is from 1999 to 2010. Okay, so we're looking at 1 decade here. If you look at cocaine and heroin overdose deaths, I mean, they either went down or they went slightly up. The red line right here, this is opioid analgesics. This is opioid deaths from deaths from opioid overdose. Went from 4,000 the number annually is 4,000 deaths to over 16,000 deaths. I mean, that's a significant change in just a decade, right? And the source on this is the CDC. Okay, so this is coming directly from the CDC. So you'll see it, right? Time Magazine, The Scientist, Newsweek, right? This is becoming a bigger conversation about how do we deal with back pain? Because most providers even struggle with how do we handle this, right? But we have a way that we can actually correct it, which is awesome, right? So there is hope there.
And the last thing that typical Western medicine will offer for a low back problem is surgery. And I'd say when patients come in, a lot of times that's one of the things they're telling me, Doc, I don't want surgery, right? And so I just want to dig into surgery a little bit, just because I think people need to be aware of this. Some people are aware that, yeah, it's a really not good thing. You don't want to do surgery unless you absolutely have to. But some people I feel like are like, it's not a big deal, but it is a big deal, and we want to go through this. So here's some pictures, just visually sometimes. It's just pretty eye-opening at what surgery actually is. So you can see, the types of incisions that you need to make. You think about actually opening up the spine and like drilling holes in it and putting metal around it. It's just like eerie to look at. And like say for a fusion or like a disc, if someone's having an operation for a disc problem, a lot of times this will be somewhat of what it looks like. I mean, you basically have metal like implanted into your spine. And the thing about this, guys, is this is permanent. Like there's really, once you do this, like there's really no going back. And so that's one of the biggest issues I have with surgery is the permanent nature of it. You really box yourself in to very limited options after you do something like this. And if it doesn't go well, you're kind of limited as to what you can do. And just, this kind of, we shared this article just to kind of highlight this problem. And that this problem isn't just talked about, it's actually in the research right now. And it's actually got a very specific term. Failed back surgery syndrome is the official term that is labeling this problem of saying, hey, I've had back surgery, it wasn't effective. And it's such a problem that we now have a term to define that in the research. Yeah. And I would say there's a part of this that I just want to share with you. Minimizing the likelihood of this problem, failed back surgery syndrome, is dependent on determining a clear etiology of the patient's pain. So if we haven't been really careful to understand what's causing the problem before we have surgery, then that's going to be an issue, right? That's going to be dramatically increase the problem we're going to have with that. So I think that's huge, and we're going to talk about that in a little bit. We're saying, hey, work really hard on the front end to really work with your doctors and everyone else that you can to really understand what is the cause of this thing, right? Because if we just kind of casually go into this, the outcome of surgery is not going to be good. Yeah. Recognizing those who are at high risk, so there's some characteristics of people that this is going to be higher for. So we need to recognize those people. And exhausting conservative measures before deciding to go into a revision surgery. And I cannot stress that enough. Like, exhaust every conservative measure that you can before you box yourself into something that's a permanent change that you're making into your body.
Yeah. One of the numbers that you'll hear is they'll say, well, 95% of low back surgeries are successful, or 98% of low back surgeries are successful. What they mean by successful is that the fusion was successful, right? So if the doctor says the fusion was successful, that's a successful surgery. But if you ask the patient, are you out of pain? Are you back to doing the things that you want to do? Do you have full range of motion? Those rates plummet to less than 30%, right? So just understand that when they say successful spinal surgery, they're saying, was the actual procedure successful? Was it a surgery that the doctor was satisfied with, right? They're not talking about patient outcomes when they say successful surgery, okay?
And there is also this phenomenon of you have a back surgery that automatically increases your risk for a second back surgery. Yeah. And that's in the Spine Journal. We've seen that multiple times. If you talk to a lot of spine surgeons, they will be very open with you about that. That's saying, hey, having this surgery will increase risk for further surgery. So keep that in mind too, guys. This is real stuff. And so part of what goes into understanding the etiology or the cause of the problem in the first place means you ask better questions. I'm amazed at how many people I'm going through their history, I'm going through their intake form that they fill out. I see that they've had surgeries. I may ask them a question about that. Why did you have that surgery? Or what was the goal of this surgery? Or what exactly, you had a fusion, spinal fusion. What parts of your spine were fused? Or, certain things that I feel like most people should know. I mean, if someone's digging into their body, that they should kind of know what happened. And I'm amazed at how many people are like, yeah, I'm not really sure. I'm not really sure why they did that. I mean, I had this kind of symptom, and I'm not sure what the outcome was, and I'm not sure exactly where they were working. And I'm just like, man, like you have to own your health, because if you don't take responsibility for your health and you hand that off to someone else, like you can't have that same expectation as if you're handling your health. So please be responsible. Please really make sure that you're paying attention and really doing your due diligence, your homework, because this is you. This is your body. This is your life. And you've got to take care of that. So what are the risks of this procedure? That's a great question. Hey, know all the risks before you go in. when you're weighing that decision? What are the costs involved? Just to kind of give you guys an idea, just a brief synopsis here of some of the costs. If you have an anterior cervical fusion, that's $44,000. A cervical fusion, that's $19,850. You have a decompression surgery, that's $24,000. Lumbar laminectomy, where they're actually taking parts away from the lumbar spine, that's $18,000 to take pressure off. Lumbar spinal fusion, what we talked about, $34,500. Those are just kind of some rough pre-surgery costs there. And also, costs alone for surgical decompression and complex fusions range from $23,724 for the former $80,888 for the latter. So you can see the huge range.
Complex surgery, $80,000 to $100,000 is not uncommon.
Yep.
Right.
And then when you combine that with imaging costs, medications, MRIs, rehab, disability, all that combined, the average cost is well above $100,000. And the direct costs are astronomical, may reach as high as $169,000 for a lumbar surgery, fusion, and $112,000 for a cervical fusion. So, I mean, guys, it's costly in terms of your health, in terms of your quality of life, in terms of your financial situation. So just be careful.
The other thing I would add to that is don't just stop at, well, my insurance is going to cover it, right? Then you got to know more than just, is my insurance going to cover it, right? I was working with a gentleman, he had a work injury, he was going through a work comp, he ended up with a cervical fusion, right? Because his work required that he go to a surgeon. The surgeon said, hey, we're going to do surgery on you. He wanted out of pain, so he went through with it. Why? Because in most cases, work comp's going to cover it, right? So don't just stop at, well, my insurance is going to cover it, okay? Know all the costs associated with it, but don't stop there. Ask even better questions.
Yeah, just because something's cheap doesn't mean you should do it. If your insurance paid you to jump off a cliff, would you do it? No. Anyways, just think about that. So what are my expected outcomes? What can I reasonably expect from this? Because if you have in your mind one expectation and realistically what you can expect is something completely different, well, you should probably know that. May I interview 10 of your patients? That's a great question. Can I talk to some people that have literally gone through this with you, and how are they doing, right? And it's nothing against the doctor, it's nothing against the procedure, but you should really know what kind of life that person's living.
Can you interview 210 of our patients? Yes, you can. Interview as many as you would like.
Okay, what does the research say? You look into the research. The research will tell you a lot of truth there. Kind of some stuff that we've shared with you. What are my options? That's a good question. Is this the only thing that we can do, or are there other things that we can do? Is this treating my symptom or correcting the cause of the problem? And I tell you, of the principles that we teach people, I would say this is a foundational one. That what you're doing, is it addressing the symptom or is it addressing the problem? And I feel like when you see those stats from an over-counter medication abuse, well, you take so much to get that problem where you're affecting your kidneys and you're having renal failure and that kind of stuff. That means that's not really, that medication over all those times and all those years hasn't really addressed the problem, right? If it addressed the problem, it would have never gotten to that point. And so it's just kind of like how we crutch along and limp along, and it's because it's not addressing the problem, it's addressing the symptom.
Yeah. A lot of times what we hear to go along with that is we'll have patients that say, well, I just live with it, right? And that's not true. You don't live with it, you live around it, right? And that's the scary thing about low back issues, is that you set this new normal for your body, right? So I'll have patients that say, well, I get normal low back pain. Well, what does that even mean, right? What is normal low back pain, right? Dr. Andrew and I don't have low back pain. That's normal, okay? So if you have any kind of low back pain, even if it just hurts a little bit, okay? Or when I do a certain activity, right? But I can still work through it. That's what we hear all the time, right? But I can still work through it. It doesn't matter. Your body's just whispering to you right now. Eventually it's gonna scream if you don't take care of it, okay? So just be listening to your body, and it's trying to tell you something, and understand what normal is. Normal is not having low back pain.
And so I kind of briefly went through this earlier, but this is the three-legged stool that we talk about. The adjustments and rhythm. The adjustment is basically we're taking that subluxation and we're clearing it out of the spine. We're restoring proper nerve flow to your body so your body can be healthy and healing. And that typically, most cases, people have waited for a really bad problem to take care of themselves, and so they've got accumulated damage in their spine, and it's taken weeks, months, years for this problem to fully develop where it is, and it's not just going to go away in one day, right, or one adjustment. And so there's got to be some consistency with the healing process, just like there was probably some consistency with the breakdown process. And so that's kind of all that means. The breaking bad habits, that means that there's certain things that we are doing on a daily basis that can recreate our problems. And I can give someone perfect care and perfect adjustments, but if they're going outside of the office and they're doing all sorts of things, maybe knowingly or unknowingly, that are driving themselves backwards, well, we're going to be at a standstill at that point. That person's not going to make progress. And so if they don't make some changes in their routines and their rhythms in their life, then they're really going to be frustrated because it's going to be hard for them to move forward. And the exercise to strengthen, we're really passionate about the soft tissues as well. The ligaments, the tendons, the muscles, those are the things that are around the bones and the nerves. And so if we just move bones and nerves around, but we lose track of what's around them, then we're not going to be as effective as we could be. And so we work with those things, ligaments, tendons, bones, or muscles, in order to get those good changes to happen, in order to help people keep their adjustment once they've got adjusted. So that's a really important part of it.
So in our office, we talk about 3 different sources of stress, okay? Everybody thinks about the traumas, right? And we're going to talk about that here in a second. Just understand that there's also toxic stress. So that's the foods that you put into your body. That's the chemical substances that we put into our body or that are around us, pollution, that sort of thing. And then there's thoughts. And I would say 80% of the stress that most of us experience is thought stress. It's the emotional stress. It's busy schedules, and it's, hey, I'm not getting along with my spouse, or hey, my boss is after me, or hey, it's deadlines, or it's busy schedules and the kids need to get to this activity and that activity, right? But we're going to really focus in on the traumas as it relates to back pain, because this is a very practical area that we can talk about. The first one is what we call macro traumas. So macro meaning big, so we're talking about big traumas. These are the obvious things, right? It's the car accidents, the slips and fall on ice, or down a flight of stairs, or out of a tree when you were younger climbing trees, or sports injuries, right? I take care of hockey players. They get smashed up against the boards, right? Football players, that sort of thing. So these are kind of the bigger traumas. These are the obvious things that it's pretty easy to say, oh yeah, I can see how somebody can get subluxated in that type of situation, okay? An interesting fact about car accidents is that Yale University did a study a few years ago that showed that any car that goes faster than 8.2, so 8.2 miles an hour or more, can cause whiplash or damage to the spine. So just understand that, even a little fender bender, if it bent metal, it probably did something to your body, right? To some level, okay? So it doesn't take a lot, so know that as well. And then we also talk about micro traumas.
Yeah, and the micro traumas are just the little things that we do. I mean, I'll ask you, did you spend at least 12 years in school taking tests? Some of the tests I took were hours long, especially in grad school. Like, we were days long, like a bent forward posture, right? You think of just school alone, right? Have you ever been reading a book? Do you have like a little thing like this that you kind of do this with? A cell phone, right? You can't go anywhere these days. What are people doing? They do like this, right? What does that look like for my neck? Does that look like that's a good thing for my neck? No. But who would think a cell phone could cause a spine problem, right? It's how we drive in our cars, It's how we sleep. I mean, have you ever slept wrong and woken up like, man, that was not a good night's sleep? Or you were out camping, right? And you were just, or on a bad mattress. I mean, have you taken falls? Have you played sports? Have you, it's those little things that can happen along with life that can slowly kind of weaken our body. And, hours at a desk, what is your job like, right? Are you plastering your face to a screen for 8 hours a day? That can create that. So just tons of stuff.
Dr. Andrew, I'm going to take a quote from him. He probably doesn't even know I remember this, but earlier, a few days ago, he had mentioned, he was talking with a patient about their overall health, and they were a little confused, I think, about, hey, I'm having this pain that's going on, what caused it? And one of the things that he said is that the state of your health isn't what you did yesterday or a week ago or a month ago, it's what you've done your entire life. Right? And so you have to understand that things add up over time, and that although you had a car accident, yeah, that's important. We want to know that, but just know that the 1 + 1 + 1 + 1, the little things add up over time into bigger issues. And that what you've done for the first 30, 40, 50, 60 years of your life, whatever age you're watching this at, know that all of that adds up over time, and that when you come into our office or we're trying to address the cause of low back pain, we're trying to make up for what you did the last 30, 40, 50, 60 years, right? And that takes time to do that. So sitting is a big issue. Dr. Andrew touched on this. A saying, it's an actual issue, is because sitting is the new smoking. And we also say that sitting is to your spine what sugar is to your teeth, right? It's that bad for you. It breaks down the spine. Your body was designed for movement. Genetically, your body expects movement. Sitting behind a desk, slouched over in a chair for 40 to 50 hours a week isn't healthy for the body. But I also recognize the other extreme. Our construction workers, our plumbers, our electricians, our mechanics that we take care of. You're on the other extreme where you're bending and twisting and lifting things in all sorts of different positions, right? And so that can be unhealthy depending on the position that you put your body in, right? And so just know that sitting isn't good for you. Try to avoid that. Sit, stand, desk is really good as well.
And so there's really 5 ways of the way that we really measure for subluxation and objectively check for subluxation. And so these are, if you have a low back concern, these are things that you're going to want to do. You're going to want to have checked for with your spine and your nervous system. And so the 5 things are motion palpation. What that means is we can take the spine and with our hands and we can feel how it's moving. We can take it through certain ranges of motions, turning it, having it bend from side to side, forward and backwards, and we can really feel whether that's got good smooth motion or not. So that's really what motion palpation is. And when you have a subluxation, well, what do you think that motion is going to feel like? Is it going to be smooth, or is it going to be rough, or is it going to be stuck, right? It goes more one way than the other way. So that's kind of what that is. And then static palpation is just really feeling the position of things where they are, and it's feeling the tissues around the bones as well. And so a lot of times a huge sign for me to pick up on a subluxation is I'll be feeling the muscles. And is there tension on one side of the spine or the other? Or is there more on one side or in one area than the other? So the muscle can really give me clues as to say, hey, body's saying, I'm trying to protect this area with this tight muscle because there's a problem here, right? So a subluxation can create nerve irritation, which can create a tight muscle, which can give us clues on that. And then also...
Go ahead. Real quick. To talk about static palpation, a good analogy for this is if you picked up an apple at the store and you were looking for like a bruise on an apple, you could definitely notice that bruise on an apple. That's what tight muscles or inflammation around a joint feels like, okay? And it takes time. It's taken years to acquire that skill of doing that, so it's not just something you can just do to somebody at home. But that's kind of the example I like to use, is like a bruise on an apple.
Yeah, and it's like edema. You'll hear that word edema. It feels boggy, it feels odd, and it's not like the rest of the apple, right? It's kind of so that's kind of what that is. And range of motion, this is a great classic way to measure for subluxation or check for subluxation. Is when we have subluxation, that's going to affect our motion. we're going to have less motion when we have subluxation. And so when we can objectively measure a patient's range of motion with what we call in kilometers, and we can see deficiencies in motion, which can lead us to saying, hey, there's subluxation going on here. And that's a huge goal for a patient. A lot of our patients that come in, they want better motion. They want better flexibility and those things. And clearing subluxation can really help with that. So posture, that's a really easy way as well. Like a posture is just an easy visual way to say, is the body in a good place? Are we being affected by subluxation and nerve irritation or not? So there's certain things that we look for in posture, certain baseline things of, hey, our ear should be above our shoulder. If our head's forward or backwards or side to side, that's not a good thing. Our shoulder should be over our hip, and our hip should be over our ankle. Certain things. If our spine is starting to do certain things and change in certain ways, we're not going to see those standards visually with a person, and that can tip us off and saying, hey, you have subluxation, you have nerve irritation that we can see.
The other thing with posture, to understand how nerve irritation affects this, when your body senses nerve irritation, what it does is it creates a postural deviation away from what we consider normal. Okay? And so earlier I used the example of myself. Part of the reason I did that is because when we talk about posture, I talked about an antalgic posture. So what I did is my right hip actually shifted up and my left hip shifted down. The reason for that is my body sensed that there was nerve irritation in my low back. So what it did is it changed my posture so I wouldn't experience more pain. Right? So posture is kind of a window into the spine. Okay, so if you've seen somebody with scoliosis, you'll know that their body will be shifted. Why? Because that's a significant display, right? That's a pretty significant change in the spine. So that person's posture really has changed their entire life unless we catch it at an earlier age. Okay, so posture is an important one.
An X-ray is a really powerful one to see, and we can measure exactly which bones are moving properly and which ones are. We can see alignment. We can check for maybe other more serious problems. We can check for safety of adjusting a person, which is really important. A lot of people are concerned about, is the adjustment going to hurt? Is it going to hurt me or whatever? And a lot of times we'll take an X-ray with the patient to say, yes, it is very safe. We want to make sure we do all the due diligence to make sure that it's safe and also that there's not deeper problems going on. And so X-ray is a great way to see the spine and not only see where it's at now, but what's probably happened in the past. What kind of care is someone going to need to get to the outcomes that they want to have. Sometimes subluxation can be silent. It can be like a cavity in your mouth. It can be silent. It doesn't create pain or symptom for years, and then it will create symptom at the end. And we'll see, hey, this is not like a 2-week back problem. This problem has been going on a long time, and that requires something different than something that's been more acute. So we can also see that, which is great.
So there's a big difference, just to kind of finish this up for you guys, just to explain chiropractic care and how it works, is there's kind of 2 different types of care. There's palliative care and there's corrective care. Okay, and so both of them have benefits. Palliative care is using chiropractic as a medication, right? It's really using chiropractic as a Tylenol, as an ibuprofen. I go to the chiropractor, I have neck pain, I walk out, I don't have neck pain, I come back when I hurt, right? It's using chiropractic as a medication. Whereas corrective care, the goal with corrective care is to say, okay, we want to get you out of pain, but we want to get you back to where you're stable, right? And you're healthy and you're optimizing your health, and not just getting you healthy, but also keeping you healthy so that you don't relapse, right? The hardest part for us is we see a patient that sees awesome success and then they relapse with their care, right? Because they have, they can't come into the office or their time or something, they fall away from care. And so what happens is our goal in our office isn't to just do palliative care where you symptomatically feel better, but corrective care where we actually correct the issue so you don't have these flare-ups or kind of this roller coaster effect with that. So if we can help you guys out in any way, we would love to take care of you. If you're a patient in our office and you have questions about this, bring those in, and we look forward to sharing with you next time, guys. Take care.